Unit 17 is the immune system. It's a very complicated system, so follow along carefully. We've divided it into two videos. This video includes Part A, an introduction, Part B, what are germs, Part C, non-specific immunity, and Part D, specific immunity. As we said, the immune system has two videos. These are the topics in the first video, and these three topics are found in the second video. How does the immune system do it? How are specific T cells and antibodies produced? And finally, how are the antigens neutralized or destroyed? Let's begin with Part A, the introduction. We're always faced with external harm from injury and infection. Injury results in damaged tissues. When that happens, germs are able to enter the body. Infection is the presence of germs that may or may not lead to disease. Notice infection is not the same as disease. Disease is manifested in two ways. Something the germs do to you, they are pathogenic, or something that your immune system is doing to the germs. The immune system functions to neutralize and destroy the germs. The immune response is a reaction between the immune system and germs to keep you well. They'll describe more about this later. Inflammation is an early stage of the immune response. Immune tolerance is a lack of immune response to host cells. This develops before birth. Resistance is the ability to avoid disease. Susceptibility, on the other hand, is the lack of resistance. The immune system is different from other organ systems in the body because it doesn't consist of separate organs like the stomach or the kidney, but it includes tissues and cells located in various organs throughout the body. An exception, though, is the lymphatic system. It does consist of some discrete organs. The lymphatic system includes two groups of organs: primary lymph organs, including bone marrow, where B cells mature, and the thymus, where T cells mature. The secondary lymph organs are the other group. They include the lymph nodes, the tonsils, Peyer's patches, these structures that filter germs from the lymph. The spleen is a secondary lymph organ, as well as a part of the cardiovascular system. The immune system is a network of molecules, we call them molecular effectors, and cells, these are the cellular effectors, scattered throughout the body, responsible for immunity. Molecular effectors include T cells, receptors, antibodies, complement, and many other substances. Cellular effectors, on the other hand, are many types of cells, including mature B cells. These are plasma cells that produce antibodies. T cells that directly attack and kill the germs. Macrophages that eat germs. Antibodies are produced by the immune system in response to infection and are the best measures of the immune response. So, for example, the presence of an antiviral antibody indicates a past or present infection by the virus. Before moving on, let's look briefly at herd immunity. This is a decrease in the severity of an epidemic. It results when many individuals in a population are immune to the disease, either through natural exposure or vaccination. If most individuals are susceptible, shown by the clear circles, herd immunity is absent. Therefore, one infected person can spread the disease to many people. The dots with the red are infected people. If most individuals are immune, herd immunity is present, the odds are that an infected person will spread the disease to many others are greatly decreased, as shown by the yellow circles. Eventually, the disease may disappear. The immune system is extremely destructive, so it has to know which cells to attack. Macrophages and T cells must not attack tissue cells. They have to attack the germs. This is a story of how the immune system does it. Part B, what are germs? Notice we've been referring to germs in quotation marks because the term is a layman's term, a general term. Germs are pathogens or infectious agents. They include microorganisms such as bacteria, viruses, and protozoa, as well as parasites and fungi. These contain molecules called antigens. An antigen, therefore, is a molecule, usually foreign and usually protein, capable of causing an immune response. Better definition of the immune response, then, is a complex reaction between the immune system and the antigen to neutralize or destroy the antigen. Antigens may be free molecules, or they may be parts of a cell or a virus. The cells include infectious agents such as bacteria and parasites. They also include abnormal cells such as tumor cells and transplanted tissue. All of the proteins in the figure are antigens. Essentially, any molecule, especially protein, not produced by the body, is foreign and considered potentially harmful. Therefore, such a molecule must be identified and destroyed. Let's use a virus as an example. The principles will also apply to any other microorganism. Viruses contain a nucleic acid core, DNA or RNA. They're surrounded by a protein coat. In some, the protein coat contains spikes. Proteins on the spikes are receptors used for attachments. Viruses grow by attaching to and entering a host cell. The viral nucleic acid then becomes part of the cell's nucleic acid and takes over protein synthesis. It instructs the cell to produce new viruses along with the viral protein. Therefore, the host cell ends up containing foreign proteins, the viral proteins. All of the proteins in the figure you see are antigens. A test for viral infection is to look for the viral proteins, the antigens. This would indicate an existing infection. Here is another example using bacteria. Bacteria are prokaryotic cells. We discussed these briefly in one of the early units. Bacterial structure includes a nuclear area containing DNA. They're surrounded by a wall composed of polysaccharides and proteins. These polysaccharides are unique to bacteria, and they're not found in humans. We'll come back to these when the complement system is discussed. The proteins have various functions and are the major antigens. They also secrete toxic molecules that act as antigens. They reproduce by fission, so efficiently produce great numbers. A test for bacterial infection would be to look for bacterial proteins, the antigens. This would indicate an existing infection. Let's look at some of the characteristics of an antigen. Antigens are actually quite a bit more complicated than simply a foreign protein. An antigen may be foreign, or your immune system may think it's foreign. The foreign antigen may be harmful as in a pathogen, or it may not be harmful. This includes allergens. An allergen is a substance that you're allergic to. It includes grafts. That's another name for transplanted tissue. Even though the graft is beneficial, your immune system doesn't know that and tends to attack and destroy the graft. Vaccines are another example of a not harmful yet foreign antigen. Sometimes the immune system thinks the antigen is foreign, as in normal host cells in an autoimmune condition. For some reason, the immune system starts attacking the person's own tissues and cells. Tumor cells are antigens that are thought to be foreign because when a tumor develops, the cells become kind of different and it produces some proteins that are not recognized by the immune system as host cells, but as foreign cells. Viral infected cells, the same thing. The virus has produced some proteins, some antigens that your immune system attacks. Vaccines function by stimulating the immune system to attack specific antigens. It requires molecules that are identical or closely similar to the antigen and complementary to the molecules of the immune system. It may contain inactivated or dead microorganisms or fragments of the microorganism proteins injected into the host. Organisms undergo mutations, that is, changes in the genetic material, resulting in the production of slightly different proteins. Using a virus as an example, it contains many different proteins. In this example, the square, the triangle, and the green diamond are proteins. If a mutation occurs in the DNA of a microorganism, or RNA in the case of an RNA virus, a slightly different protein would result. Assume a vaccine is designed to recognize the square protein. Then assume a mutation occurs in which the square is changed into a triangular protein. The triangular protein is no longer identical or closely similar to the viral protein, the antigen, and it's no longer complementary to a molecule of the immune system. The vaccine will no longer work. However, if the vaccine was designed to recognize a different protein, such as the protein at the end of the spike, it would still work because that protein in this example has not changed. A concern is that vaccines in use now might not protect against a slightly different microorganism due to a mutation creating a different protein. Well, now you're probably wondering what in the world are we getting at? Let's begin with part C, nonspecific immunity. Nonspecific or innate immunity is a type of immunity in which the immune system does not have to know which cells to attack. It functions against antigens in general rather than a specific antigen. Examples include barriers, such as the skin. The skin keeps out germs. Mucous membranes. This is the inner lining of the internal organs. Cilia, present on much of the inner lining of many internal organs. Acid in the stomach. All of these would tend to prevent bacteria from entering the body, or other microorganisms as well. Antimicrobial substances may serve in a nonspecific way. These include interferon. It's produced by certain white blood cells and fibroblasts, and they inhibit viral reproduction. Complement, we'll talk about this later. Iron-binding proteins such as hemoglobin and others. Antimicrobial proteins, These are found in sweat, blood, and intestinal fluid. Much is still being learned about these antimicrobial substances. Fever, oddly enough, is another nonspecific form of immunity. It increases metabolism of the immune system and it decreases reproduction of microorganisms. So, contrary to common thought, fever is not a harmful side effect, but it's actually a beneficial result of infection. Inflammation is another that can be nonspecific. It increases the efficiency of the immune system. Phagocytosis by neutrophils. They also work in a specific manner. And macrophages. NK cells, natural killer cells. They go around punching holes or digesting target cells. Fever results when the thermostat in the hypothalamus is set to a higher temperature. Pyrogens are fever-causing agents. Fever is mediated by prostaglandins. These are released from white blood cells in the hypothalamus to reset the thermostat. Other functions of prostaglandins include mediate pain. Synthesis of prostaglandins is inhibited by aspirin, and so aspirin functions to reduce fever as well as to alleviate pain. Endogenous pyrogens, such as interleukin-1 and other peptides, are released from neutrophils and macrophages. Exogenous pyrogens, such as bacterial endotoxins, are released from microorganisms. About inflammation. Well, inflammation is a way of transporting the body's defenses to the site of an infection. It also destroys the antigens. Inflammation has several general steps. Now, here's a view of a blood vessel in a tissue. Tissue cells are shown, and certain white blood cells are shown within the flow of blood. Germs enter the site. The blood vessel will dilate and increase its permeability. This allows fluids and white blood cells to exit the blood vessels and attack the germs. The symptoms of inflammation are pain. This is due to the release of various chemical agents. Redness. This is due to vasodilation and increased permeability caused by vasodilators. Histamine is one vasodilator. It's released from basophils, mast cells, and platelets. Kinins are plasma proteins that cause blood vessels to dilate and increase their permeability. Complement C3A. This increases histamine releases, so it contributes to dilation and increased permeability. Notice when the blood vessel dilates, it's as though the wall has been stretched and holes in the wall get bigger. Swelling, edema, also occurs because fluids are leaking into the tissue spaces out of the vessels. Symptoms and steps of inflammation include increased numbers of white blood cells, carry out phagocytosis, and coordinate other functions. Heat due to increased metabolism. Also, there's inhibition of clotting in the site of the infection, the inflammation. This is due to anticoagulants such as heparin from basophils and mast cells, and formation of a clot around the site. This is to prevent the spread of the microorganism due to clotting factors. Phagocytes are an important part of inflammation. As mentioned, they include neutrophils, monocytes, and macrophages. Phagocytes exit the vessels by first of all sticking to the vessel wall. This is called margination. And then they squeeze out through the vessel between the endothelial cells called diapedesis. The phagocytes are attracted. This is a form of chemotaxis by kinins, by complement C5a, by phagocytosis, by other substances. Phagocytosis is increased by receptors, such as effector binding site of the antibodies. Now, I realize I'm using some terms and phrases you're not familiar with. We haven't introduced them yet. We will. Complement 3 T3b, that's another one of those. That increases phagocytosis. Phagocytic cells can function when the germs bind to the receptor on the phagocytic cell. This is called adherence, and the germ then is ingested into the phagocytic cell. It then is digested. Inflammation may occur in one form as one form of an allergy to common allergens, type 1 hypersensitivity. Basophils and mast cells release vasoactive substances, including heparin and histamine. Steroids decrease many of the effects of inflammation. So the use of steroids may be used to treat inflammation. It decreases the symptoms due to inflammation to common allergies. But steroids have to be used carefully because they also decrease the efficiency of the immune system. Let's look at the other form of immunity. This is specific immunity. Although nonspecific immunity is very effective, the body would face certain death without specific immunity. It's as though one is a backup for the other. It functions against specific antigens as opposed to nonspecific that functions against general antigens. There are two types of responses in specific immunity. One is the primary immune response. It occurs after the first exposure to the antigen. It usually is too slow, so illness results, and it's also weak, but eventually it gains enough strength to destroy the antigen. An example is mumps. If you've never been vaccinated for mumps and you're exposed to the mumps virus, you will get the mumps. This is the first primary response. The secondary response occurs after a second or later exposure to the same antigen. So after having had mumps, if you're exposed again, you don't even know you had it. Your immune system cranks up and gets rid of the mumps virus. Usually no illness results. Oh, you may feel a little down one day or feel like you're coming down with something, but you don't catch the mump. It's fast, strong, and long-lasting. It requires a special kind of cell called memory cells that live for many years, they respond quickly, and they multiply fast. Remember now, a disease is due to something germs do to you or something you do to the germs. Mumps is an example. The virus causes the disease. When you're exposed, you get sick. Tetanus is another example. The bacteria that causes tetanus makes you sick. An immune response will be mounted to get rid of the tetanus bacterium. However, there's a catch. We'll come to that in a moment. Poison ivy, on the other hand, the first time you're exposed to poison ivy, there's no reaction between your immune system and the antigen. That is, the poison ivy itself is not toxic. But the second exposure results in the complications, in the illness, because now your immune system responds to the presence of the poison ivy antigen. Breathing problems result, fever results, and many other conditions result. So that's an example of the illness caused by the presence of something that's not really that harmful. You probably know people who said, "Oh no, I'm not bothered by poison ivy. because I walked through a field of it one day and nothing happened. Well, if they show off and take some poison ivy and rub it on their skin, they may have a severe reaction. What they didn't realize was the first time the person walked through the field of poison ivy was the first exposure, and there was no reaction. There are several forms of immunity. Natural immunity occurs through natural exposure, like exposure to the mumps virus. Artificial immunity, on the other hand, is acquired through exposure to the antigen by medical intervention. That means by vaccination. Immunity may be active, that is, your immune system actively produces the immunity. Both of these examples are active. But immunity may be passive. Instead of your immune system developing the immune response, the immune response is transferred artificially. So we can combine these four into four types of immunity. There's naturally acquired active immunity. This is the usual immunity, as in exposure to mumps. Artificially acquired active immunity is similar, except the immunity is the exposure is through vaccination. It's through artificial. The immune system is active, it produces the immune response, but what caused it was an artificial exposure. Then there's naturally acquired passive immunity. This is immunity transferred, for example, to a baby across the placenta before birth or in the mother's milk. Babies are really pretty healthy because the mother has provided natural immunity through the placenta or by way of the milk. And then there is artificially acquired passive immunity. We'll use tetanus as an example. Tetanus is caused by an anaerobic bacterium, Clostridium tetani. It causes skeletal muscle contraction, and it has a 50% mortality rate. Treatment is often the administration of a tetanus antitoxin containing antibodies against the tetanus toxin. These are produced commercially, either in horses, we call it horse serum, or in humans. So artificially acquired passive immunity is immunity that's transferred by injection. Take tetanus. The antitoxin is used because if a person is exposed to tetanus and has not been vaccinated, the disease develops very rapidly and the immune response develops too slowly to prevent the disease. So it must be transferred by injection, hence the horse serum. Potential treatment for other types of infection, especially under conditions of severe stress like wartime, is to give a patient plasma from a person who has already been infected. Plasma contains antibodies in a variety of types, which will then combat possible infections. This is the end of the first part of the immune system. You're now ready to go to parts E through G.